practices for breast cancer survivors. October is a month, it is observed as Breast Cancer Survivor or Awareness Month actually. And we had an opportunity to work with breast cancer survivors over a period of time. And certain practices which has really helped them, do better in their day-to-day life from the perspective of physical activities, from the perspective of mental strength and awareness, about the whole living thing. I thought, why not to do that session in this month of breast cancer awareness. So in today's session, I'm going to show you 5 important practices, and those 5 important practices are really good, in trying to open up this area so that you can enhance your functional activities on day-to-day life. At the same time, I'm also going to show you 2 breathing, which has helped the people we were associated with or we are still working with immensely. So I'm starting with my practice, the first practice. So this is basically the practice is meant for the survivors who have sustained through the whole thing. And after surgery and all, when they start getting into normal day-to-day lifestyle, how should they go into the practices so that they can enhance the functional activity in those areas? Because of the surgery, this whole area becomes stiff. The blood circulation reduces in this area. So the practices are going to help in that one. Okay. So few things to remember. One of the reasons for the cancer is that your body becomes more acidic. So you have to make your body alkaline by the pattern of eating, by breathing and all. And of course, we are going to do some breathing, which will help in that. But you'll have to make sure that your eating pattern is right as well. So that's an important component. Now, moving into the practice, which is the physical aspect pretty much, the 5 setup practices. The first practice, I'm hooking my fingers. Once I have hooked my fingers, I'm pushing my elbows apart, completely working through this area. Apart. Once you get your elbows apart, move. Right to left. Right to left. Just opening up that area. You can also start adding the movement of your head. This way. Right to left. This way. This way. A very simple movement. As a beginner, if you had a surgery, and after that if you want to do, you can start just with 5 rounds and then you can go on adding. Okay. Now the second one, that was the first one. In the second one, again I'm hooking my fingers. This time my left hand is close to the body and the right is away. You can keep changing for even development. So I'm hooking my fingers over here, raising my arms up, going back. See, 1, 2, 3, 4, 5. You have to remember that during the movement, your head doesn't move. It doesn't come forward. If it comes forward, that will strain your neck. So we have to make sure that the head is aligned above the neck, and the only thing which is moving is your arm, and you are working through your ball and socket joint, your scapula, and of course, in contracting and stretching the frontal part of the area as well as the back. So again, showing it. See, I hook my fingers, elbows apart, going out as much as you can. You may not be able to go down so much. In front. 1, 2, 3, 4. At any point, if you think you're stuck, stay there and pull apart. So basically, maybe the area is tight and there is not enough flexibility for you to move around. Hold it, pull apart so that you can enhance flexibility. That was the second practice. For the third practice, I'm just rolling all over. So it's like complete circular and anti-circular movement, or you can say clockwise and anti-clockwise. So again, I'm creating a hook, okay, and I'm going clockwise. 1, 2, 3, 4, 5. Opposite. 1, 2, 3, 4, 5. So this also, as you can see, I'm just going like, pretty much at the upper level. You'll have to see gradually as you start improving and as the flexibility improves, you will see you are able to, go flawlessly all over. That was the third practice. For the fourth practice, we are just going with a very simple movement and you can actually start with that one. My arms are out in front. Body tall, core active, make sure your spine is taller. As you inhale, with inhalation, you start stretching your arms out. As you exhale, bring your palms into each other. Again, inhale out very gently. Do not strain your neck area. This needs to be free, otherwise you'll end up with neck pain. Exhale, in. Inhale, exhale. Inhale, exhale. Inhale, exhale. So, like I started with 5 rounds, you can start with 5 rounds. Make sure that the form is right, your spine is taller, your core is kind of engaged, your shoulders are involved in the movement, your scapula are involved, but there is no strain in this area, so keep protecting this area. That was our fourth practice. While going with the fifth practice or the last practice, which is really the simplest one, in that one what we do? We replicate the movement of a cone. So what do we do? See, 1, 2, 3, 4, 5. 1, 2. Very simple movement. What are we doing? We are just enhancing the flexibility, the fluidity, the movement of this area. This is the area which actually, gets stiff, due to your surgery now. So it's very important you continue working in this area. So this we did clockwise and you also have to do it anti-clockwise, both ways. See, opening up of this area. Make it as deep as possible. At any cost, you will not allow your head to come forward. That will strain your neck. So we actually did 5 practices in total. I'm just going to, recap it once so that you remember. Our first practice was like hooking the fingers. Hooking the fingers, elbows apart, this movement. This was my first practice. In the second practice, I changed the hooking of the fingers. And then I went back, forward, as much as possible. Back, forward, back, forward. My head is straight, going back as much as you can. In the third practice, again I changed my hook. And then I rolled over clockwise and anti-clockwise. So this was the third practice. 1, 2, 3, this way. And then I went anti-clockwise and I changed my hook again. See, this way. This was the third practice. Third practice. In the fourth practice, I got my arms straight in front, inhaled. Opened up my arms to the maximum. If you want, you can just move your arms at the back, kind of pulse it over there. Exhale. Inhale, exhale. Inhale, exhale. That was the fourth practice. And the fifth practice, which all these practices you can start slowly with 5 rounds and go ahead, increasing the number depending on your flexibility, depending on your practice. The fifth is one which you can do anywhere and you must do as many times, maybe every 1 hour, that's very easy and immense power to increase the fluidity and flexibility in the whole of the area. That is replicating the movement of the comb. So this is the one. See, 2, 3, 4, 5. Opposite. 1, 2, 3, 4, 5. That was, and you have to do it with both the hands. Those were the 5 practices for the breast cancer survivors. 2 breathings which I am going to show you. One breathing is yogic breathing. Yogic breathing consists of actually your abdomen, your chest and the collarbone going apart. However, as a beginner, especially even for normal people, it takes a while to get into that combination. So in the beginning, only stick to your abdominal breathing, and then if you are comfortable, go with chest breathing. Leave the third segment apart for time being. That has to be the last thing when you have good control over your breathing pattern. So in this one, we are only going to do abdominal breathing. So as you can see, my abdomen, when you inhale, the abdomen goes out. When you exhale, it goes in very gently. So you are filling your abdomen like a balloon, very gently. Filling it in a flow without any jerk and releasing it in the same flow. You have to start at a very simple level and then build upon that. Make sure you don't stress yourself, do only as much as you can do. So initially when you're doing it, try and become aware of the length of your inhalation and exhalation. And as you become a regular practitioner and become very comfortable with the practice, you should see the length of inhalation and exhalation, and you should try and make sure that the length of exhalation is double the inhalation. The second practice, it is called pursed lip breathing, which is a very popular practice, and it enhances your the lung capacity by eliminating extra carbon dioxide and by allowing maximum oxygen intake to go inside your body, so that the functional unit of the body, the cells receive the decent amount of oxygen. So in pursed lip breathing, we inhale from the nasal passage. We press the lips, purse the lips, create a small O shape in between the lips and start exhaling out of that lips. Now, that exhalation is actually directly associated with your abdomen gently going in. So, in the process, as the abdomen is going in, the air is coming out of your mouth. Okay? So, I'm just going to show you a few rounds. This position. Inhale. Inhale. Simple practice. These simple practices are so effective that when you start doing it regularly, you will see that it is actually, if you don't strain yourself and do it regularly, just in a span of few days, you will start seeing the changes overall, not only in your body, but in your breathing pattern, in your thought process, also in the capacity of your body. So please go ahead, do these practices so that you can actually not only cope up with the recovery process beautifully, but come out of this whole thing gracefully. Do your practice, let us know how does it work. We would love to hear from you. Continue doing yoga, discover yourself.